Today you're listening to Beyond the Caseload, the Wellness Series, where pediatric specialists come together to help families and providers better understand early development and support children during the years that matter most. Your host is Gabby, social media and engagement coordinator, and each episode features expert guests dedicated to educating, empowering, and supporting children and the families who care for them.
Welcome back to Beyond the Caseload, the Wellness Series. This is the podcast where we break down child development in practical, real-life ways for families, as well as giving pediatric providers language that they can actually use in everyday conversations. So in our first episode, we talked about how movement shapes learning, regulation, and confidence, and today we're shifting into a topic that honestly comes up all the time, and this is picky eating. Parents will come in and say things like, she only eats 5 foods, he eats everything at school but nothing at home, or she used to try everything and now she refuses. And pediatricians also hear these same exact concerns at well visits every single day. Most of the time, picky eating is a normal developmental phase, but that doesn't mean it's not stressful. Mealtimes can feel exhausting, emotional, and honestly super confusing for families. So that's actually why we created our Feeding and Mealtime Wellness Visits, and this is to give families that guidance and reassurance before things escalate to stress or power struggles, and also without having to jump straight into that evaluation or diagnosis, because we know that these visits can feel kind of scary. To help us break this down, what's typical, what's a red flag, and how families can make mealtimes calmer, I'm joined by 2 of our feeding specialists. We have Miss Gabby Alvarez. She is an occupational therapist supporting children with sensory processing, routines, and confidence across daily activities. And Regina DeCanto, a speech-language pathologist here at Progressive Pediatric Therapy with a background in feeding, early communication, as well as music therapy, bringing a unique lens to connection and emotion at the table. Together, they help families and pediatricians understand when picky eating is part of development and when it might need a closer look. So, Gabby and Regina, I'm so excited to have you here on our podcast today.
Thank you. Hi, ladies.
Thanks for having us.
So, I wanted to start with the big picture because I feel like a lot of families often feel like they're the only ones dealing with this. From your experience, what are the most common concerns parents bring up around picky eating or feeding challenges?
Yeah, I think for me, the most common concerns what parents will bring up to me is, and it always comes from a good place of heart, they want to make sure their child is eating a variety of different foods and they want to make sure that they're eating from different types of food groups. So a lot of the concerns I kind of get are, oh, my kiddo only eats chicken nuggets, French fries, pasta, macaroni and cheese. I call it like the beige diet, where it's a lot of canned foods, a little bland, not as exciting, not as colorful. So I try to kind of ease the parents by saying, when they're young, they're just figuring this out. They're trying to learn. They're trying to figure out what do I have control over and what I don't. And especially when they're young, like 2 and 3, they're really voicing their opinions. They're very opinionated at this age. So guiding parents that yes, there is some normalcy. You can expect some kids to have a stage of kind of picky eating, but where you remain constant is that expectation of we're always interested in trying something new. Sometimes we like it, sometimes we don't. Or sometimes it doesn't have to be your favorite food. It could just be a neutral food where you have it once in a while. And kids are learning that too. They're just figuring out, oh, I don't have to be in love with every single food. No, you don't. You could just like it. It doesn't have to be something you love. And that's just part of that toddlerhood, young childhood years. They're just trying to figure it out.
For me, some of the concerns are very similar. Parents often bring up limited diet, limited wanting and trying new foods, right? So a lot of our kiddos maybe avoid trying foods that are outside of their comfort zone. I also hear a lot maybe self-feeding, right? Sometimes using utensils, bringing food to mouth, sitting at the table or wherever parents partake in mealtime. Those are some of like the main concerns that we hear in OT, aside from, of course, the sensory concern, right? Not liking certain textures or only eating certain textures. And that's the most that we hear, yeah.
Yeah, and I love that you guys said that because so many parents think this must mean something is wrong when really it's such a shared experience. And that leads me right into my next question because this is where families and pediatricians often feel stuck. So, how can we tell the difference between normal picky eating and then something that might need a closer look?
When I
Yeah.
think of normal eating versus picky eating, right? I think of that range of normalcy or of what's common. And it often has to do with how severe our picky eating is. Maybe we are picky eaters, but we have a fair variety of foods that we eat or that we tolerate. And we tolerate maybe a little bit of variety or changes in that food, whether it's changes in the color, the shape, the size, where it's served. We're a little bit more flexible. So when I think of a kiddo that falls within that normal range, I think of kiddos that might have their preferences, but they're okay trying new foods. They have a fair, variety. They're okay with different textures, even if it's not all textures are all the time, but we can functionally get those 3 meals a day. We can get those snacks in, of course, depending developmentally where they are as far as feeding. But we can, for the most part, go somewhere, have a meal, or find something in a menu that we'll like. I feel like that falls within kind of like that normal range of picky eating.
Yeah.
And for
And
you,
I
Regina?
like that you said severe because I think that's a great example of that 0 to 60 moment. A normal picky eater is going to maybe argue with you. I don't want it. No, kind of whine about it, but they're not putting foot to the gas like it's a meltdown situation. It's really causing like a disruption in their day. And Gabby, I love that you said severe. It's a little bit more clear for parents. And then parents, check in with yourself too. Are you feeling a little anxious when they're not eating? And just kind of taking a look at that. I think too, normal kind of picky eating, like Gabby said, we might be hesitant with new foods, but eventually they're exploring. They're licking it, they're kissing it, they're taking a bite, a thank you bite, they're putting it away. It doesn't mean they have to eat a full serving of it. The idea is that they are willing to experience it, even if that means you kind of have to put a little encouragement behind it, and that's okay. Versus more red flags are going to be like, again, that severeness we kind of talked about. Maybe you're seeing gagging, you're seeing really extreme behaviors, vomiting, you're seeing those kind of things like distress kind of signals when it comes to eating. And then, two, are they hitting enough foods in the food groups kind of thing? Young children, I remind parents like fruits and vegetables are kind of on the same playing field for nutrition. Of course, we want ideally them to eat both fruits and vegetables, but if they're two and they've got a bunch of fruits and we're still working on the vegetables, I'm okay with that. That's fine for now. You just keep encouraging the vegetables. But if you have a child that is not taking any protein, no fruits, no vegetables, accumulation of all of that, that's going to warrant more of a, ooh, I think we need to go see a feeding therapist and see what we can do about this.
Yeah, and I think the distinction between what's normal, what needs a closer look at, is super important, especially when we're trying to avoid unnecessary stress or referrals, but also not
Mm-hmm.
miss when a child actually needs that support.
Mm-hmm. Yeah, definitely.
So, like I mentioned previously, the questions parents come in with, one thing we hear all the time is, why did this come out of nowhere? Or they used to eat everything. What happened? So, why do so many kids go through phases like only eating, like you mentioned before, just beige foods or refusing foods
Mm-hmm.
they used to love or eating totally different at school versus at home?
Yeah. I mean, a lot of these eating phases are driven by young children and their brain development. And it's not stubbornness or bad habits. It's just them exploring what do I have control over and where's the gray area. And they just got here. They're learning how to kind of do with that. The beige diet, the beige foods kind of example, that idea of it's crackers, it's chicken eggs, it's pasta, it's breads. One of the reasons kids tend to go towards that is because it's really predictable. Or pretty eaters too. It comes packaged. So the Cheez-Its look exactly the same every time they open that bag of Cheez-Its versus a blueberry. A blueberry, you're going to open the package. You might get some hard ones that are tart, some soft, squishy ones that are sweeter. You're going to get variety. And some kids don't do well with that. They really want it to be predictable. And same thing with being at school. So that predictability, they're around friends, they're around peers at school. They're distracted, especially those 5-year-olds. Their first time in school, their first time in a cafeteria, they're socializing. So they might be a little pickier because they want the comfort food for now because they're now gearing up for, oh my gosh, I'm making friends. They're figuring out their kids have different friends that aren't them. So they're really working through other developmental milestones. And sometimes food just takes a side, kind of goes in the back seat for a little bit. And they want predictable, what's going to make me not hungry so I can focus on making friends and have this 30 minutes of socialization that I don't get the rest of the day.
Like Regina said, there could be just so many reasons, and that's why it's so important as therapists, and of course, if you're able to do this as a parent as well, to really investigate and think about what kind of led us to picky eating, because there could be so many reasons, and sometimes we're able to catch those reasons, and sometimes they happen without us even noticing. So even simple things like maybe a traumatic event where maybe something didn't settle well in the stomach, and then they got sick from it, and now that food was maybe not reintroduced in the best way. Sometimes when we're transitioning those little ones from milk to solids, sometimes we don't necessarily transition the way that we should, or any little event like that. So many things can lead to kiddos being picky eaters.
Definitely.
So now let's talk about support because not every family needs therapy, but many still need that guidance. So, what exactly is a feeding and mealtime wellness visit, and how is it different from a formal feeding evaluation or a feeding therapy session?
Yeah, I love this question. I love that we have this option because I think you're right. There's parents who are struggling, and those are the ones that things slide under the rug because it's not a problem, but it is for the family. It's impacting them. So we have what we call our wellness visit, which is more preventative. It's really low pressure. It's more like a consultation with the parent. And it's kind of designed so that if you're in that gray area where, okay, well, they are trying new foods, but yeah, we've been eating kind of the same diet for a long time, so no, they're gaining weight. No, they're doing everything else great. It's nothing, not a concern yet. It's a parent's opportunity to talk to a specialist and really just be that soundboard of what's going on in their world, and then get advice from us on how we would go. Like Abby said, maybe we didn't go about transitioning from, getting off the bottle in the right way. It's giving the parents those strategies so that it doesn't become a problem later on. And it's not a full formal feeding therapy evaluation where we're scoring things and we're doing this and now you got to commit to therapy weekly. It's very much parent driven. So you can pop in, have that consultation, that wellness visit, and then try those strategies for a couple weeks. And then if you feel you want to consult again, you consult again. It's really designed to kind of give parents more of a power and less intensive approach on the child themselves.
Absolutely. When I think of that wellness visit, I agree, Regina. I think of it's more that consultation base where we're having these conversations and we're trying to figure out, is this something that is really causing severe dysfunction, or is it something that the family really just needs strategies for? And sometimes even our kiddos that maybe don't qualify, so they have an evaluation and then they didn't qualify for feeding therapy. A wellness visit can also be useful for just strategies and tips. And maybe there's just little areas that parents want to perfect or they want assistance with that would still be beneficial for the patient and the family, but maybe not necessarily something that the kiddo needs a full evaluation or feeding therapy for necessarily.
Yeah, exactly.
Yeah, I think that distinction is really empowering for families to hear, especially those who feel like they're in that gray area. And that's really the heart of these visits. So, how do wellness visits help families lower that stress at the table and better understand what's typical for their child?
Yeah, I think kind of going back to it's more about the parent. So while feeding therapy, we're really working with the child. And yes, we're working with the parent too. I know in my feeding sessions, I really encourage parents to be a part of it so they see what I'm doing. It's just more intensive versus if you're a busy parent and you just want to talk to someone, it allows the parent to hear it and get those strategies. And you're talking grown up to grown up versus working around with the child. So it offers a little bit more building confidence for the parent, which we all need because no one left the hospital with a manual that said, here's how you're going to raise your child. Especially when you're a new parent, you're really just learning through trial and error. So it does wellness visits help give parents a lot more confidence and relieves them that they're going to help their child in the best way without needing intensive therapy for their child.
And there's so much information out there too that sometimes it's nice to just speak one on one to a therapist that's really taking into consideration every factor of your family and of your child versus maybe reading things on the internet that maybe will not apply to your child or that don't take all those little quirks or differences into consideration.
I always like to leave families with something that they can actually try right away. So, what are a few practical research supported strategies that parents can start using now after they listen to our podcast to make mealtimes calmer and more manageable?
That's a
So
question.
for me, from an OT perspective, I think of a lot of sensory play and sensory play around food. Sometimes we want our kiddos to try new foods, but we don't really let them explore or be a part of meal preparations or get to play and touch and smell food prior to consuming foods. And we have these high expectations that kiddos are just going to accept new foods on their plate. And I think if we think for us, even as adults, how many times are we exposed to a food before we maybe try it? So same goes for the little ones. So I think if I had to give one piece of advice would be to get playful with it, have them have fun and take away that pressure of always having to put a mouth and consume. There's many steps that we can take before we get to that.
Yeah, and from a speech perspective, mine's very similar. Kind of going back to we're just relieving the pressure of food. Think about as a parent, how are you speaking to your child about trying these new foods? Maybe it seems harmless. Just take a bite. You liked this yesterday. You're going to eat your veggies first. Then you can have that. It puts added pressure. And again, it comes from a good place. We're just trying to be good parents here, but you want to use different neutral language. I tell parents, it's your job to provide the food, but it's the child's job and how they eat it. So I don't mind if I put a tiny piece of a half of a cookie on my dinner plate with my child who's got blueberries next to them. They want to eat the cookie first, so be it. I provided the boundary of I only give you half a cookie and I put it next to your blueberries. If they want to eat cookie first, be my guest. Gives them the power back. So some neutral language you can say is, hey, this is what we're having today, but you get to choose how you eat it. Or you don't have to eat it. Try it. What does trying look like for you? And then have them lick it, have them kiss it, because the idea again is parents were providing the boundary, and that's so important. We need to, as parents, make clear boundaries, but we want to give freedom within those boundaries. So when you're doing that, you're giving the boundary by saying, here are blueberries, but you're giving the freedom of, but you could try it how you want to try it. Doesn't matter to me. You can encourage and say, oh, you licked it. We could also put on our teeth. We can also take a bite and spit it out. How do you want to try it today? And that just, again, relieves the pressure of this, I have to do it or there will be a consequence.
Yeah, these are such small, easy shifts, but they really can change the entire tone of mealtime. So, I also wanted to speak directly to our pediatric providers who may be listening. So, how can feeding and mealtime wellness visits be a helpful tool when you're unsure whether a child needs a referral or just early guidance and reassurance?
Yeah, definitely. I think the easiest one to tell is if they're stagnant weight or is their weight loss. Stagnant weight can definitely be something like maybe at your 6 month visit, you were a certain weight, but then you said, hey, we're going to try new food or try solids. And then that 9th month visit, exactly the same. But you see other milestones going up. They're starting to move more. They're maybe pulling themselves up the stand. So you see the activity level going up, but yet their weight stayed the same. That should be a red flag because they're moving more. They should be eating more. So that's one thing I kind of look for as like a, ooh, I'm going to pay attention. And then I also talk to the parent and just say, how is this impacting you? Tell me what's a normal day for you? What are you normally packing and or providing for lunch or what's in their lunchbox and kind of gauging, are they hitting a couple of the food groups? Is a lot of the same foods? Is a lot of processed foods that the parent is saying, I'm stuck, this is the only thing they're eating? Or is it more on the parent of they're not realizing, hey, do you realize you have a lot of chips and packaged foods in your diet? Try something else. So giving those real suggestions and then making the referral when you start to see I've given suggestions and we're not really getting where maybe we need a little bit more of an intensive approach.
Yep. I think when it comes down to providers asking families, always getting an idea of what a child is eating in a day, of what that variety looks like, of what acceptance looks like, of what flexibility around food looks like, and how difficult mealtime is. I feel like that's always a good indicator of how it's going and when it's appropriate to make a referral for services.
Yeah.
Yeah. So, before we wrap up, if a family or provider is listening and thinking that this sounds like what they need, what is the best next step?
Yeah, so if this is resonating with you and you're like, oh, this is my kid, or, this is, as a pediatrician, this is one of my patients, you want to look for those low pressure options. So I would definitely encourage a wellness visit. At the wellness visit, the feeding therapist can also say, hey, we're going to try a couple of consultations and I think this is all they're going to need. Or they can even tell you, nope, this is going to be a little bit more of a formal feeding evaluation. They will literally guide you and then they're the feeding specialist. So they're going to know whether or not this is more consultative route or more intensive feeding approach is needed.
I would agree. Same. I think consulting with a provider, I think for me, step one is a consultation. And then seeing from there, is it something that we need to just have follow-up visits just for guidance and strategies, or is it something a little bit more concerning where we should be having an evaluation and a formal plan of care to address feeding goals?
Yeah, it's like the bridge between the let's wait and see and formal feeding evaluation. It's the middle ground between those two things.
Awesome. And that is it from me. Thank you both so much for joining us today. And thank you everyone for tuning in to another episode of Beyond the Caseload, the Wellness series. If picky eating has felt stressful, confusing, or emotionally draining, a Feeding and Mealtime Wellness visit can offer clarity, reassurance, and super simple strategies without needing a full evaluation. You can learn more or schedule a visit on our website at pptforkids.com. And if today's episode was helpful, please share it with a family or pediatric provider who also may benefit. Because small shifts at the table really can create big gains in confidence and connection. Thanks again for listening, and I will see you in our next episode.
Thanks for listening to Beyond the Caseload. If today's episode resonated with you, share it with a colleague or a friend who could use it. And don't forget to follow so you never miss an episode. Until next time, take care of your kids, your caseload, and yourself, because there's always more beyond the caseload.